They told you, with your personality, with your hair, with your hijab, with your skin color, with your preferences, with your gender. They told you, with their silence, with their words, with their resentment, with their absence. They told you, you don't belong. Yet, here you are.
Hi there, my name is James Boyle. I am a second year medical student at University College Cork, and I am the chairman of the UCC Surgical Society.
Hi, my name's Tricia Campbell. I'm currently an ST5 in Trauma and Orthopaedics in the east of England, and I'm the EOE Communications Officer as well as BOTA Publicity Officer.
Hi, my name's Ellie Priestman. I'm a fourth year medical student at Bristol University. I'm also the ASiT Equality and Diversity Ambassadors co-chair, as well as being the vice president at the Bristol Women in Surgery Society.
Hi, I'm Michael Okocha. I'm a general surgery registrar in the Southwest, and I'm the Association of Surgeons in Training Equality and Diversity Officer. I really hope you enjoy this episode of 50 Faces of Surgery. I hope that it leaves you feeling valued, inspired, and most importantly, welcome. Here I am.
Tricia Campbell is a Trauma and Orthopaedic Registrar in the Northeast, graduating from Queen Mary's with a Bachelor of Medicine, as well as an intercalated degree in Sports and Exercise Medicine from University of London. She has since gone on to complete a master's degree in medical education. Beyond her role in hospital, she has previously taken on the role as president for the British Orthopaedic Trainee Association between 2019 and 2020, and has combined her love of sport with medicine as a motorsport doctor for Motorsport UK. She has also spent a year as a leadership and management fellow at Health Education England. Her research is award-winning, gaining her several prizes for her work. Tricia is also a great advocate for inclusivity in education. This was clearly recognised when she was invited to a panel conducting an independent review into diversity of surgical leadership at the Royal College of Surgeons of England.
So Tricia, I just want to ask you 3 questions, if that's okay. So the first question I have is that I just want to ask if you could just take me through your usual morning routine. So obviously it's different in a minute.
Yeah, so I guess at the moment, because I'm on maternity leave, I've got a 6-month-old baby. My morning routine is pretty much dictated by her. So when she wakes up, the whole house wakes up. But so the year previous, I was a leadership fellow at Health Education England. I can tell you a bit about my morning routine there. So pre-pandemic, we all worked in an office, starting about 9 o'clock. So for me, I'm kind of programmed to wake up early. So we wake up about 6 or 7 o'clock. And do some exercise before I start my day. So I've got a Peloton, which I love. So I'll get a quick class in before I start the day, which just makes you feel like you've achieved before you've actually even left your house. So start the day with a Peloton class, have breakfast. I'm definitely someone that needs to have breakfast before I can function. And then I would drive into work. I would then, I'd have to make a list because things were coming from every angle, and if I didn't have a list of what I needed to achieve that day, I'd get really confused. So I start off by making a to-do list, then check my emails, and I tended to have 1 or 2 meetings each morning. So that's what my morning looked like in my leadership year last year, but obviously things look a little bit different now.
Okay, and then well, next question, thank you for that, would be could you tell me about where you grew up?
Yeah, sure. So I'm a northern girl. I grew up in Leeds. I've got one sister who's 4 years younger than me. Both of my parents are accountants, and they both grew up in Trinidad and Tobago, and they came over for university. So they both went to Leeds University and stayed. Yeah.
And how was it like there growing up?
I had a fantastic time growing up. I went to an all-girls school, which I think is pretty instrumental in me being where I am now, because they instilled in us a confidence and the knowledge that all of the girls can achieve whatever they want to achieve. And I think that for me has really stuck with me, having that confidence from a young age. Another thing I was thinking about before is my parents are both from Trinidad, which they grew up where anyone could achieve anything. So it was common for them to see people in positions of power of any race. So growing up, I was always brought up with, you can do whatever you want to do. And I think that again has given me a confidence that perhaps other people don't have.
As a fellow Northern lass, I appreciate from Bradford, the other side.
Nearby.
Nearby. So why did you apply to medicine?
I think I was one of those people that always wanted to be a doctor since I was about 5 or 6. At that point, I don't think I even really knew what being a doctor meant. But if you said it, people were like, oh yeah, that's really good. And you're like, yeah, okay, I want to be a doctor because, you know, I want to do it. Everyone said it's really good. But for me, a kind of defining moment was I was a really keen tennis player. And I had an injury. My parents took me to see a sports medicine doctor. And in hindsight, I don't think he actually did very much for me. But I just thought, wow. He had this private clinic. We went in and he was so attentive and looked after me and gave me a plan of what we were going to do. I thought, I want to be like that. So I guess it's something I wanted to do from early, and then had a lot of reinforcement.
And once you got in, what was medical school like for you?
So I went to medical school at Barts in London, and I had a great time. I think anybody watching this that also went to Barts in London will have a chuckle, because they'll know they also had a great time. And it's a very diverse medical school. It's in the East End of London. I had a fantastic group of friends that I met pretty early on. So I met one of my best friends in my first PBL group, and some friends from like the first Freshers Week, and we've been friends, you know, ever since. I definitely threw myself into it. So I was on the tennis team, the sailing team, the rowing team, and on the committees for those. I even joined the University of London Officer Training Corps because my flatmate at the time joined and was telling me all these stories about how fantastic it was. Like, right, I want to do that. So I was in the Officer Training Corps for a year. So I think I threw myself in. I joined loads of societies, but actually I gained so much from them. Rather than just playing the sport, I think you learn leadership, you learn team skills, which you can't get if you just go to the library. So for me, I think I got as much out of medical school as I possibly could have got out of it. And then, as you mentioned, I intercalated in sports and exercise medicine, which meant I had another year to do more things. And that year was a good year for me because it really started me on the path to where I am now. So I chose that BSc because I looked down the list and I didn't want to be in a lab, and that was one that wasn't in a lab. But actually, it was taught by a load of orthopaedic people, and I thought, yeah, this is what I want to do. And it also opened up that avenue for me to see, actually, you don't just have to be hospital based. So there's a lot of people doing sports medicine type things. So all the football doctors were there, and I went to a lot of meetings with the FA and things like that. And I thought, yeah, I like this kind of outside of the hospital environment as well. And then that's kind of kept as a theme throughout my career. It's how I ended up doing the motorsport stuff.
Where did you do your training initially?
So I've been everywhere. So I medical school in East London, and then foundation training I moved to West London because I wanted to change. At that point in time, I thought moving from one part of London to the other part of London was a change. So I did my foundation training in Northwest Thames, so Chelsea for the first year and then Hillingdon for the second year. I then applied for core surgical training and got a post in Manchester. Being from the north, you know, moving up north isn't, you know, it wasn't a big thing. So I moved north with a couple of friends. So some friends that I had from medical school, we all thought, let's go somewhere different. We all moved up to Manchester, had a flat together, had a fantastic time. Saying that, Manchester, I did have 1 year in Barrow, which isn't Manchester, but still managed to kind of go back every weekend. I didn't get a registrar number the first time round. and didn't really know what to do. So I thought, I'll go back home. So for me, home was the Royal London, because I'm a Barts girl. So I went to the Royal London for a year and had a fantastic time. So I was down south again, and then finally got my number up in the northeast. I've been in Newcastle for 5 years now. So I've been everywhere. I think for me at that point in my life, I was single, you know, and for me, orthopedics was what I wanted to do. So I was happy to move around. But as I've got older, I've kind of thought, God, had I met my husband earlier or had ties, what would I have done? I wouldn't have been able to move around so much. So I guess I was just fortunate that I was able to move around.
Absolutely. And what was your first week as a registrar like?
So because I didn't get a number straight away, I did that year at the Royal London, and I was put on the registrar rota. So in my mind, that's my kind of first time being a registrar. And the Royal London is a busy major trauma centre. So I was in at the deep end, coming from a little DGH up north to a massive trauma centre. But another thing, again, a theme throughout for me is it's all about your peers and the people you're working with to provide that support network. And I've got friends from that year at the Royal London who I'm still friends with now. So it's about building that network of people to support you. So the first week was challenging. It was eye-opening, and you're kind of on your own, on call, seeing the stuff, but you do have support. So I would say definitely build a support network.
So, you know, you've had such an amazing journey and you've done so much and achieved an insane amount. Like, I think I was part of a few societies in med school and I was fatigued, so I don't understand how you could do that. Okay.
Yeah.
What challenges have you faced along your journey?
So I've been thinking about this. I've definitely faced challenges. I think as a woman, I faced challenges, you know, a woman in a male-dominated specialty. As a Black woman, I faced other challenges. But I think for me to detail, you know, all the barriers that I faced, I don't think is helpful. But what I think is helpful is how I've overcome them. And for me, the biggest thing has been finding allies and a support network. I think that is the most important thing you can do. So if something happens, you've got an independent person you can talk through it with. So just some examples, you know, as a woman doing a trauma list, I remember once I turned up, I just sat quietly in the corner I was on call to do the list. And the whole team were like, where's the surgeon? Where's the surgeon? Like, I'm here. But to their minds, I couldn't possibly be the surgeon. And the same happens with a patient, you know, you spend ages counselling them, going through the consent form, you know, explaining what the operation that you're going to do. And at the end, they'll be like, well, when am I going to see the doctor? Who's doing the operation? So I guess it's the assumption that I'm not the surgeon. And I think a lot of it is subtle. And sometimes you think, oh, was that or was that not? But I think it's important to have a group of people you can discuss these things with, a support network. I think it's massively important.
And how did you address those issues in the moment?
I think it's changed from when I was younger to how I would deal with them now. So when I first started out, I think I take things very personally and I kind of go home and cry, which, you know, it's not the right way to handle it, but that's how I don't think I had the toolkit to deal with it. But now I call it out. If I see something that's not right, I can't keep quiet. By doing that, I think they'll think twice next time. So if something happens, I will say, actually, I disagree, or why has that happened? I'm very vocal about things, not in a confrontational way, just in a conversational way. Say, oh, hang on, I don't agree, or just almost making light of it in a way, but calling it out. So, but that, I think that's come with experience and having that support network of people. So I would say, if you don't feel comfortable calling it out, have someone you can talk to or someone you can go to who will call it out for you.
have you had a moment in your career where something happened and it just changed your trajectory, like a defining moment?
Yeah, I've had yes. So I think when I became BOTA president, that was definitely a defining moment for me, because it gave me a platform. I was more visible, and I feel a sense of responsibility with that platform. I'm a firm believer in you can't be what you can't see. So as I was coming up, I didn't see anyone looking like me. So you have to kind of keep, build yourself up. Come on, we can do it. But I feel that if just by looking at me and saying she's Black, she's a woman, she's married, she's got a baby, I provide some hope or inspiration to the future generation. For me, that's why I'm doing what I'm doing. And I think becoming BOTA president has allowed me to do that on a wider scale. So for example, I'm on maternity leave now, but pretty much every week, every other week, I'm talking to medical student societies. I'm saying how, I've done it. You can have a family. You can be a surgeon if you're female, just so that people know you can do it. Because I think for so long, people had in their mind the stereotype of a surgeon. But that's not how it is. Things are changing, and something I think that is about to be a defining moment is I sat on the panel for the independent review that we mentioned briefly, looking at the diversity in surgical leadership. So at the moment, there is no diversity in surgical leadership. But why? The people are there coming through, but they're not making it to the top. And we've got a report coming out in a couple of weeks with recommendations. And I think that will change the culture, the surgical culture that we're working within. So I think that will be the second defining moment.
But the question I have is, if you could go back in time and speak to yourself, what would you say to yourself to inspire you and motivate you?
I think I'm very hard on myself. If something happens, I will always look at the negative. I think I would encourage myself to say, actually, you've done well. Give myself a pat on the back, like you've done well. Keep going, because I think surgeons by nature will, if there's some feedback, will hold on to that negative piece because we want to become better. So that one negative thing, but how can I make that better? But I think I do that too much, almost to my detriment. So I would tell myself, focus on the positive. Find the positive things and build on that. Because I think things may have been a little bit easier if I'd kept those positive things in my mind. One of my friends who's a surgical trainee is really big on affirmations, which I've started doing. So writing out positive things just to reinforce it in your mind. So I think just to be a bit more positive and think, you're doing well, it will work out. Just focus on the good.
Yeah, and I think that's something that, like you said, many trainees, particularly surgical trainees, and especially females, I think, are quite guilty of. And they've shown that previously with ARCPs and reflection on people's ability in theatre. And I think females often downplay themselves. So kind of going on from that, have you got any particular advice? And I know you have a lot of advice that you can offer people, but in terms of maybe a couple of key points for medical students out there or aspiring surgeons that they can follow to try and follow in your footsteps?
So my biggest thing is people. There's a saying, you can go fast if you're alone, but together we go far. And I live by that. Build your network, form your allies, find your mentors. That is what's going to make the difference. And I mean that by people your level, people above, people more junior to you, is what will make the difference. For me, I've got, if I have a problem, there's certain people I'll call and just bounce my ideas off, and they'll be like, right, this is what you need to do. Equally, there are people that will call me and say, oh, this has happened, I don't know what to do, and I'll give them advice. And I think, especially if you are not your stereotypical person that they think of as a surgeon, allies and support is even more important. So I would say reach out to people, and take people with you. So if you're working on a job, I've got friends from, pretty much every job that I've done. So I think it's so important. Whereas my husband thinks he's not a surgeon, but he thinks slightly differently. He's like, well, work is work. And, they're my colleagues. But I don't think like that. I kind of think, well, they might be my colleagues, but we can also be friends and we can work together. We can be collaborative. So I definitely would say support networks, collaboration, and just make sure you build that network with my main advice.
Yet, here you are.